Hey everyone, I'm Dr. Hosam Khalaf, your trusted clinical pharmacist at the Pharmacy channel. Today, we're diving deep into zinc, a tiny mineral with massive health benefits. Whether you're fighting off colds, healing wounds, or just optimizing your immunity, zinc plays a starring role. But how much do you really know about it? By the end of this video, you'll learn the top health benefits of zinc, backed by science, signs you might be deficient, normal blood levels and who's at risk, best natural food sources, the dangers of too much zinc, yes, overdose is real. We'll reference trusted sources like Lange Basic and Clinical Pharmacology, the BNF, Mayo Clinic, and Healthline. Stick around, this is pharmacist-approved info you won't want to miss. Important disclaimer, the information provided in this video by Dr. Hosam Khalaf, certified clinical pharmacist, is for educational and informational purposes only and is not intended as medical advice, diagnosis, or treatment. Always consult with a qualified healthcare provider before starting, stopping, or changing any supplement, medication, or health regimen, especially if you have pre-existing medical conditions, are pregnant, breastfeeding, or taking other medications. Let's start with the good stuff. Zinc is like the Swiss Army knife of minerals. Here's why. 1. Immunity supercharger. Zinc helps produce natural killer NK cells, your body's frontline warriors against infections. A 2025 study found short-term zinc supplementation boosted NK cell function by 2% in healthy adults. 2. Wound healing. Zinc is critical for collagen synthesis. No zinc? Slow healing. Lange Pharmacology notes it's essential for tissue repair. 3. Sense of taste and smell. COVID got you down? Zinc deficiency is linked to loss of taste and smell, a key symptom we saw during the pandemic. 4. Growth and development. Kids with low zinc may grow slower. Pregnant women. Zinc supports fetal development, but in first trimester, it can be harmful. 5. Cold fighter? Mixed reviews here. Mayo Clinic says zinc might shorten colds by 1 to 2 days, but side effects like nausea are common. Gentlemen, let's talk about zinc's underrated role in sexual health. Research shows zinc isn't just for immunity. It's a key player in testosterone production, sperm quality, and even libido. Here's the science-backed breakdown. Boosts testosterone levels. Zinc is critical for Leydig cells in the testes, which produce testosterone. Study. Men with zinc deficiency had significantly lower testosterone according to Journal of Reproduction and Infertility. 23. Clinical note. Supplementing zinc, especially in deficient men, may increase free testosterone by up to 30%, improves sperm quality and fertility. Zinc protects sperm DNA from oxidative damage and supports motility. Mayo Clinic cites zinc deficiency as a contributor to male infertility. Key stat: men with healthy sperm counts have 50% more seminal zinc than infertile men. Supports erectile function. Zinc enhances nitric oxide production, which improves blood flow, critical for erections. BNF warning: chronic deficiency may worsen erectile dysfunction, especially in older men. Libido and prostate health. Low zinc is linked to reduced sex drive via testosterone drop. Zinc concentrates in the prostate and may help prevent benign prostatic hyperplasia, BPH. How do you know if you're low on zinc? Look for these red flags: hair loss and brittle nails. Zinc fuels keratin production. Frequent infections. Zinc deficiency weakens immunity. Slow wound healing. Think cuts that take weeks to close. Loss of appetite or taste, a classic sign. Diarrhea in infants. Severe deficiency can cause this. Who's at risk? Vegetarians. Plant zinc is poorly absorbed due to phytates. Alcoholics. Alcohol depletes zinc. Pregnant women and elderly. Higher needs or poor absorption. Lab time. Normal serum zinc levels are 80-130 micrograms per deciliter, but testing isn't perfect. Zinc is stored in cells, so blood tests can miss deficiency. Healthline suggests pairing tests with symptoms. Pro tip: fast before testing and avoid afternoon draws. Levels drop by 15%. Pop quiz: which food has 10x more zinc than spinach? Oysters. Here's your cheat sheet. Top tier: oysters 74 milligrams per 3 ounces. Beef, crab. Plant-based: pumpkin seeds, lentils, cashews, but phytates reduce absorption. Fortified foods: cereals, check labels for added zinc. Vegans: pair plant zinc with vitamin C, like lemon juice, to boost absorption. More isn't always better. Excess zinc, over 40 milligrams per day, can cause nausea, vomiting, or copper deficiency, leading to anemia. Weaken immunity. Yes, too much backfires. BNF warns. Zinc interacts with antibiotics like quinolones and diuretics. Stick to the rational daily amount: 8 milligrams per day for women, 11 milligrams for men. To recap, zinc is a must-have for immunity, healing, and more, but balance is key. If you're unsure, ask your pharmacist or doctor before supplementing. Drop your zinc questions below and hit subscribe for more evidence-based health tips. Stay healthy, folks.